progress, theory, tapos dire-diretso tayong application para scheduled yung coaching and mentoring. Balikan lang natin yung anong magiging lecture natin ngayon. So overview, then a short recall, no? Ano yung habang discussion natin last week, di ba? So napakahaba nun. Then, we will now start the PDSA. So bakit Sir Ilde may PDSA? Saan siya part ng models for improvement, no? Bakit hindi agad PDSA Sir Ilde yung inuna? Bakit nag-aim statement pa tayo? Bakit nag-problem statement? Bakit nag-measurement tayo? Bakit nag-driver's diagram tayo, sir? Tapos in-emphasize mo pa yung measurement. Okay? Then, we will have a break for 5 minutes and we will have an examples of PDSA applied in HIV care. I have 2 case studies na in-apply ko dito. It's international and also my local. Okay? Then we will have the wrap-up. And we will have next week, no? Starting next week, we will have the mentoring and coaching. Okay? Okay. To start is, we will have a short overview muna. Ano ba yung performance measurement plan? No? Sabi natin last week, measurement system is very important in quality improvement. Ba? Ano nga ba yung 4 na measures, 4 na klase ng measures na diniscuss natin last time? Meron bang makakabanggit nun sa group chat? Sige nga, magbanggit kayo ng isa. Ano yung mga measures na napag-usapan natin last time? Ano yung mga measures na hinahanap sa quality improvement? May outcome measure ba to? Yes. Meron ba tong process measure? May process measure ba? Yes. May balance, may structure. At sometimes, meron pa tayong tinatawag na mga sub-process measures. Okay. Sir Ilde, nabanggit mo din yung 11 steps, di ba? 11 steps in creating a performance measurement plan. Okay? Ngayon, tignan lang natin, isimplify natin yung 7 steps na yon. By the way, nire-review natin yung 7 na yun, 11 na yon. Just a give reminder to everyone that actions are based upon accurate and measured data. Okay? In QI, we are very much specific in terms of accuracy and measurability of your data. Kaya nga, di ba, sa aim statement pa lang, smart ba yan? Baka naman hindi masusukat yan. Baka naman lista lang ng lista dyan. Wala naman ding patutunguhan. At iba yung nasusukat na gusto nating ipakita instead of the outcome or the process. Diba? Trying to do quality improvement without process as a process metrics is like being blindfolded. Kaya pala Sir Ilde, yung measure na nakasanayan namin sa mga QI is process at outcome tapos balancing. Ngayon nilagyan mo ng structured at remember sub-process. Sir, ano nga ba yung mga sub-process na yun? Ito yung mga, kung meron tayong gustong i-achieve, ito yung mga sub-process na to, ito yung magre-reflect. No? Ito yung magre-reflect. Ulitin ko. Itong mga sub-process na to, ito yung magre-reflect sa PDSA ninyo. Okay? PDSA matrix siya. Using locally relevant custom measures with feedback informed by staff and people with HIV experience, like someone telling you you're getting warmer. Okay? Kaya nga sabi ko sa inyo, summer na, medyo painitin natin yung QI natin. At remember, sa 11 steps ng clinical performance measurement development, sabi natin, it should be pilot tested to 2 or 3 sites or 2 to 3 records o ba? Patient's record. And meron ba dapat kang makuhang feedback from the staff and from the people with HIV? Yes, may dapat kang makuha. Remember the quality improvement principle, focus also in your consumers, no? Consumers feedback, and it's very important. Okay? Another is, in the measurement plan development, yung 11 steps na yon, tandaan nyo na ang unang diniscuss natin is kinilala natin yung mga iba't ibang klase ng measure. Hindi lang ngayon, for sure, alam ko sa puso nyo, hindi lang po, sir, ang alam namin ngayon ng mga measure ay yung mga target ng HIV cascade or reporting measure. Meron na kaming alam, sir, ngayon na outcome, process, balancing, structural, at sub-process. Okay? Remember that in your measurement plan for quality improvement, hindi lang siya nag-iisa. It should be a mix of process, outcome, and balancing measure that will allow you to measure progress towards your aim. Mamaya may makikita kayong PDSA. So, ibig sabihin pala, sir, yung PDSA, hindi lang dapat yung circle na below yung focus namin, but meron dapat palang mga pillars na tinatawag, which are your measures. Okay? So, mamaya mas mai-enlighten tayo dyan. Okay? Next, the project outcome measure should reflect aspects of the collaborative measure and viral suppression as well as affinity group outcomes measure. Okay. Remember, tandaan natin na if we are looking for an outcome measure, titignan natin yung cascade. Yung HIV cascade, saan ba natatapos? Saan ba natatapos yung HIV cascade? Viral load suppression. And when we are thinking about outcome measure, we should not just think about na-test namin, na-diagnose namin, na-retain namin to care, na-link namin to care, na-viral load test namin. Remember, those part of the cascades are actually processes. Diba? Processes yon para magkaroon ka ng viral suppression. At the end of the day, quality improvement in terms of measurements, pag outcome measure, usually, collectively, na collective measure, viral suppression yung makikita. Collectively hindi ko sinasabi yung per project. Okay? Collectively. Sabihin, pag iniisa mo yung lahat ng project na yan, ang lalabas talaga na gusto nila makita is viral load suppression. Okay? Project process measures will likely reflect a key drivers related to selected interventions. So remember, noong nag-discuss tayo ng measures, sabi natin, meron tayong drivers diagram. Naalala niyo ba yung drivers diagram? Sige nga. Ano-ano yung hinahanap sa drivers diagram? Anong laman ng drivers diagram na yon? Meron ka bang primary driver? Yes or no? Siyempre may primary driver ka. At ang primary driver, it should be your domains, no? Yung focus ng domain nyo. So kasama ba dito yung policy, procedure, people, provisions, at ano pa? Processes, lahat ng P, place, no? Another, para ma-achieve yung mga domains na yon, yung 5 P na yon, kailangan mo ba ng secondary drivers? Yes or no? Secondary drivers? Yes or no? Yes. At yung mga secondary drivers are statements in positive, no? Remember that one, in positive. So kung sa root cause analysis, negative siya, at driver's diagram, the secondary driver is a positive and specific. Now, sa driver's diagram ba, meron kang tinatawag change idea, change concept, at change package? Yes or no? Yes. Okay? At remember that one, before ka pumunta ng PDSA, dapat meron ka ng measurement, meron ka ng driver's diagram. Sir, bakit? Sabi dito, project process measures will likely reflect the key drivers related to selected interventions. Why? Mamaya, bibigyan tayo ng PDSA picture. Kaso sa PDSA picture, Sir, bakit hindi lahat ng intervention na identify namin bigla ang tinest, biglang ginawa? No? Mamaya makikita niyo na ang principle ng PDSA is one step at a time. Kaya pala, sir, nung ni-lecture mo, nung driver's diagram, sabi natin, gumamit tayo ng prioritization matrix. Ganun pala yun, sir. May prioritization. So, uunahin muna namin yung nakikita talaga namin problema. Okay? Prioritization matrix. Okay, next. Other measure may be required based on the specific improvement cycles and constraints and root causes. So may iba't ibang measures na pagkagitna ng implementation mo para ma-improve, no? Bumabalik ka sa root cause, tinitingnan mo ulit or tinitingnan mo ulit yung mga constraints, no? Bago ka ulit magplano. Pwede yon. Kasi ang QI na PDSA cycle, it's a cycle. So you go back. Okay? You go back, review everything, process everything. Choosing the right project metrics. Remember that you should have a helpful metrics. One, it support effective action and decision making. Two, illustrate the real trends. Three, measure movement towards a goal and are easy to understand and typically focus on ratios outputs tied to outcome. Ito yung kailangan yung intindihin na pag nagsusulat kayo ng mga measurement ninyo, it should have an effective action and decision making. It will support. Bakit? Remember the PDSA. The last part there is A. A talks about action. Act on the result. How you can act on a result or provide a decision making if your matrix are not helpful. If your measurements are not falling in or not aligned, no, with the outcome na gusto mong makita. Okay? Sometimes, as novice practitioners in QI, we sometimes develop misleading metrics. We sometimes develop not actionable metrics, or we have usually used the count widgets only. Ano ba yung sinasabi nating count widgets only? Ito mga count widgets only, ito yung mahilig kayo magbilang na 10 tao, 5 tao, 4 na tao. Okay? Or meron kaming 20 na kliyente, 20 lang na kliyente yung siservisyohan ko. Okay? Those are count widgets. Okay? Tangential to the goals, ibig sabihin, meron kang goal, meron kang measure, pero hindi siya nakakapag-contribute. Hindi siya nakakapag-contribute doon sa gusto mong mangyari. And can be massaged or taken out of context. So, yun yung mga tips sa inyo. And remember, the 11 steps in performance measurement development can be explained in 4 themes. You develop, which is you run your charts, you plot the outcome, you display by sharing your idea, you incorporate the measures by looking at interventions, key drivers, normal operations, and communicating it to the relevant individuals or stakeholders. This is the simplest data collection plan template that HRSA and even the Ryan White funded organization used. No? Sample or population size. So, ibig sabihin, sir, pala, pag quality improvement, not necessarily lahat ng population. What if, sir, marami kami, mga 250 yung client of na-follow up, sir, pwede ba kami mag-start muna, sir, by sample size? Yes naman. Pwede. Status, complete, waiting, review, not stated, working. Okay? Who will collect the data? You specify the name. When will the data be collected? Monthly, quarterly, weekly, daily. How will you use the data? Paano ba? Monthly performance evaluation. Monthly improvement improvement discussions, no? What's the goal? When we say goal, ano yung aim mo? For example, sabi din number field. So you have the goal. For example, you have 90%. No? Then the previous benchmark, sabi natin, oops, naka 70 lang kami. Okay? Bakit kailangan ng simple data collection plan template? One, this will guide you to really understand yung measures nyo. Okay? Matutulungan kayo nito later on pag nagpa-plot na kayo ng mga data ninyo for quality improvement. Okay? So now, let's start with the PDSA. So tapos na tayo dun sa pag-review, no? Let's start with the PDSA. Ito yung gustong-gusto nyo. Okay, nasa step number 6 na po tayo. Okay, number 6 na po tayo. Then, remember that this is the driver's diagram. And the models for improvement, plan, do, study, act, is actually the mover or the wheel to make these improvement efforts work. No? Si models for improvement, si PDSA, kaya siya nasa baba, sabihin, driver siya. Nagda-drive siya. No? Dinodraw niya yung mga in-identify mong ideas into action, no? Into an intervention or implementation phase. Remember this, that plan, do, study, act, or the PDSA cycle is the final element of the models for improvement, which introduces a testing cycle. So dito natin i-test. This cycle provides guidance on how the test change on a small scale to establish if they result in an improvement before being tested and implemented on a larger scale. So anong ibig sabihin mo dito, Sir Ilde? Ang sinasabi lang namin, ang PDSA, ginagawa siya sa maliit na steps or simple steps hanggang madagdagan mo, mapataas mo, hanggang makita mo nagre-reach na niya yung outcome na gusto mo. Okay? The PDSA allows for continuous improvement as hypotheses are clearly created, tested, revised, implemented, then adopted further. So ibig sabihin pala, sir, parang research yung PDSA, tinitest niya. Dapat may hypothesis kami. Yes. Pero remember, in research, hypothesis is only tested once. Here, hypotheses in quality improvement are regularly created. Okay, for example, marami ang naglo-lost to follow-up kasi hindi na-update yung kanilang patient information or clinic visit information. Ngayon, sabi nyo, kulang kami ng tao, sir, kaya nangyayari yan. O sige, sabi sa'yo ni Mayor or ni Medical Center Chief mo, okay, hire tayo na encoder, dala na. Okay, sabihin natin ang target ni encoder, sir, 200 kasi yung hindi updated. Pwede ba si encoder maka-encode kaya siya ng 10 per week? Ganun na muna, sir, ka-relax. Okay, sige, 10 per week. Nung nag-weekend na, nag-hire na kayo, after 1 week, tinest nyo, chinek nyo yung output ng inyong encoder, uy, 10 na-encode. Tapos itong 10, within 1 month, uy, bumalik. Pwede pala. Sige nga, what if dagdagan ko ng tao ulit? Magkakaroon ako ng encoder pero ngayon tig-20 na ang kanilang patient load. Tataas pa kayo yung pasyente namin? Ito na. So si pasyente, bumalik din. Halos 90%. Okay? So ang ibig ko lang sabihin is that in research, we test hypothesis once and validate your hypothesis result. In PDSA, hypothesis is created every time you finish the cycle. PDSA, pagdating sa ops kulang, ops medyo improvement, dagdag tayo ulit. Assumption na mag-i-increase yung encoding, mag-i-increase yung number of patients na babalik. Okay? And as you can see, the hypothesis in quality improvement, if you are talking that one, it is being revised, implemented, and adopted later on. No? Nag-iiba siya. Nag-change siya over time. Okay? Next, this is an iterative process that allows terms to make conditional changes, continual changes, and deepen their understanding of organizational improvement needs and solution. The 4 steps of PDSA cycle are described below. Plan, do, study, and act. Okay, according to Langley. Let's start with the plan attest. Okay? In planning, you should introduce a change initially on a very small scale. Okay? Sir, anong ibig sabihin natin sa QI pag plan a test or introduce a change initially in a small scale, a very small scale? It could be in a few days or on a small sample of patient. So pwede pala yun, sir, na what if, sir, yung aming mga loss to follow up ngayong linggo, 20, pwede ba, sir, ang i-update ko muna mga 5? Pwede naman. Wala naman nagsabi na lahatin mo agad. Okay? And to see change if looking is promising. Okay? So, hindi kailangan lahatin. Okay? In planning a test, during the planning phase, the improvement team needs to decide the following. What are they going to do? What they are going to do? No? At paano mo sasagutin yan? Babalikan mo si driver's diagram sa prioritization matrix mo. Ops, ito yung na-prioritize namin. Ito yung unang gagawin namin. Then when and how they will do it. Okay? Paano? Kailan? No? And who will be involved? Then what they predict will happen. How they are going to collect the data to monitor the effects of change. And what resources are needed and the time frame for implementation. So kaya pala, sir, no? Hindi kami agad PDSA pala. So mali pala yung ginagawa namin. Sir, nagpaplano na kami agad. Hindi pa namin alam yung goal namin. Hindi namin alam kung paano namin susukatin. Diba? Mawawala po kayo sa sistema all over, no? Kaya ang nangyayari, instead na ganahang gawin yung quality improvement na project, napapagod na. Kasi paulit-ulit daw bumabalik sila sa root cause analysis. Kung sa ISO pa, paratis lang nagbibigyan ng CAR, Corrective Action Report, tapos paratis lang nagro-root cause. Okay? Maybe you should look at what are the data needed. Okay? Another, in planning a test, they need to inform people about the test of change, including those people involved in the change to be sure they are willing to try. Okay? Pag kayo naggawa ng quality improvement and you want to implement that change, ensure you will have a project meeting or stakeholders meeting din. Hindi pwedeng, oy, Mama QI kami ha, ganito yung gagawin nyo. Basahin nyo na lang dun sa aming procedure na ginawa or protocol na ginawa ha. Yun na yun. Sundan nyo lang. Tapos after 1 week, i-check ko kayo. Oh. Pwede ba yun? Diba? Eh di gulantang lahat. Ano yung QI? Anong gagawin? Diba? And that's what happened, no? When in the reality, when I am having this quality improvement and quality assurance aspects, no? Nag-o-audit ako, may natatanong ko agad na, oh, anong ginagamit nyo na ngayon sa quality improvement nyo or quality assurance or management system? Ay, sir, nag-electronic QA quality management system kami. Okay, sige nga, patingin. Chine-check nyo yung medication errors, no? O sige, paano nyo kinukompute to? Tingnan natin doon sa electronic QMS kasi meron eh. Medication error, pero bakit ang nagre-report pharmacy? Paano na-detect ng pharmacy yung medication error? Sabi nila, sir, kasi nababalitaan na lang namin na may pasyente na mali pala yung nakuhang gamot dito, tapos si nurse, ibabalik yung reseta. Anong rule ng nurse? Sir, wala po. Tagabalik ng reseta na mali namin. Medication error daw yon. That could be true. It's a medication error. In what aspect? Dispensing. Pero anong target nila? A whole medication error. So bakit pharmacy lang yung may participation? Kasi sabi nila, sir, quality improvement namin yan. Amin yan. Kami lang. No. The answer is no. You should involve all people or individual about the test you are doing. Sir, nag-activate kami na dapat yung mga chart ng pasyenteng ita-transfer, re-reviewin namin within 2 hours. Sir, kaso ang problema namin, sir, hindi namin magamit yung chart kasi wala pala doon sa pinirmahan ng pasyente na i-allow niya kami to access the chart. Ano mangyayari sa'yo? May data kang kukunin? Mabe-measure mo ba yung date, yung improvement na gusto mo? Siyempre hindi. Ha? Inform is a very important tool. No? Now let's check the case study of Uganda. No? Uganda is, naaalala niyo yung nutritional problem doon sa mid-upper arm circumference ng mga bata na may HIV. Okay. So sabi doon sa improvement team plan, sabi nila, ang gagawin natin, ang plano natin, we create a station for nurse to take and record the MUAC of each patient who comes to HIV clinic. Dapat si nurse pala yung magre-record ng mid-upper arm circumference. The person at registration desk will tell all the patients to go see nurse after registering. So may station na kami. So meron tao na nagre-register. Tapos yung nagre-register, dapat i-inform niya, after this, punta kayo kay nurse. Susukatan kayo ng MUAC. The patients who are seen at the station by the nurse and are classified either moderately or severely malnourished will be sent to see the doctor. So si nurse na naka-duty doon sa station, dapat alam niya na, teka lang, moderately or severely malnourished, i-refer ko kay doctor. Ma'am, sir, ipipila po namin kayo. Okay? Next, the team will test this change for 2 days. Sabi nila, okay, 3 tao ang involved. Registration, si nurse, si doktor. Sabi nila, gagawin yung test of change in 2 days to see whether all patients are assessed by MUAC and classified. Sige nga, i-test muna natin ng 2 days kung kaya natin sila ma-assess talaga or classify. Now, the nurse will record the data and the registrar will compile the data for review at the end of 2 days. Okay, yun yung plano nila, no? Meron ba silang what do you want to do? Meron. 1, 2, 3. Meron ba sila who will do it? Nandyan. Si nurse, si registration desk, si registration officer, tsaka si doctor. How they will do it? Nakaspecify dyan. Si nurse, may station. Si registration person, ida-direct niya yung pasyente for registration sa MU o measuring ng MUAC sa nurse. After si nurse, maka-check siya ng MUAC, pag moderate or severe, i-refer niya kay doktor. So meron silang how. Nasagot din niya yun. Paano daw nila susukatin? Sinabi doon, after 2 days daw, susukatin nila kung nakaka-cover ba nila lahat na assess. Then, sino magre-report? Sabi niya, si nurse, i-record niya yung data, si registrar yung magko-compile ng data. So, yung mga tanong kanina sa plan attest, nasagot niya. Okay? Ganun siya. Now, let's go for the do the test. Okay? In do the test, to test the proposed solution, a team needs to carry out the planned activities and record what happened. Okay? There are 2 important activities in do. Carry out the plan, document the plan. Okay? Sir, pag-document the plan, meron ba dapat din akong documentation of what transpires or what happened? Yes. Sir, pag nire-record ko ba, positive lang yung i-record ko? No. You should also record or document even the problems and unexpected observations. Remember, in our measures, you have so-called balancing measures and structural measures. So, kailangan makita yung lahat na dynamics na yun. Okay? Document what worked and what did not work during the testing process. This information is important to assess the solution for the problem that was identified. Okay? Example in the Do the Test case study. Let's go back with the Uganda Health Center, the Do. Sabi natin, oops, the team carried out plan of tests and have the nurse do the MIWAC after the registration. The nurse stayed at the registration desk all the day, first day, but had to go to the wards for part of the second day. Some patients therefore were not seen by the nurse. The data collected by the registrar showed that this change worked well on the first day, but not as well as the second day. The results are presented below. Day 1, day 2, number of patients in the HIV clinic, number of patients who were assessed, and percentage of patients who were assessed for nutritional status. Okay. Himay-himayin natin. Kanina, sabi sa plan, a test. Create a station for the nurse. 2, si registration, idadirect niya kay nurse para sukatin. Pag moderately to severe malnourished yung patient, i-refer kay doctor. Correct? Yun yung guidelines nila. Yun yung plano nila. Sabi na, sige, sukatin natin in 2 days. Ang nangyari, nung first day, ang ganda ng performance ng kanilang QI. 68% na measure. Nandun lang si nurse kasi sa station, hindi siya umalis. Problema, on the second day, si nurse kailangan mag-ward kasi may absent. Wala nang sumukat ng MIWAC nung umalis si nurse. Nangyari, bumaba yung percentage na na-cover nila from 68 to 52%. Okay? So, ibig mo bang sabihin, Sir Ilde, sa PDSA, sa do na part, hindi kailangan mabulaklak na result ang ibigay namin na 100% perfect. Okay? No, not necessarily. Remember in QI, pag nakikita po namin na puro 100 at perfect po yan, naku po, naku po, may problema dyan. Sugar-coated yung inyong report. Okay? Naku po, may problema sa data collection. Okay? Tapos, ano pa ba? Ano pa bang kulang? No? Ano pa bang nangyayari? Minsan, sige sir, pakita na lang namin na okay yung QI namin, quality improvement. Kasi ayaw namin umulit. Kaya 100% na achieve na namin. Okay? No yun. Okay? Next. Study the result. Oh sir, meron na kaming do. How we will study that one? Okay. During this step, the team will decide whether the solution tested had the desired results. Remember, may hypothesis kayo sa plan. May hypothesis kayo. So dapat here sa study, pag-aaralan nyo, yung hypothesis ba namin workable? Tignan nga namin. Kailangan namin tingnan. Okay? Examine the results of your solution from both formal and informal data. Pag sinabi nating formal data, these are graphs of time series data. So itong time series at informal data collection, i-discuss natin to next week. Paano i-plot yung run chart. Okay? Pag meron na kayong PDSA. Okay? Mag-workshop muna tayo. Tsaka namin ituro yung pag-graph ng time series. Okay? Then, an informal data collection. When we say informal data collection, example, team members' observations about the process that work, where the team needs to ask, what is the data really is telling us? Ano yung informal data collection? Ang informal data collection, ito yung tinatawag namin minsan na annotation. Okay? So, ibig sabihin, merong part sa graph na tumaas, lalagyan mo yan ng annotation box at ilalagay mo doon yung observation. Okay? The nurse stays in the station for the whole 8 hours. Second day, mag-a-annotate ka, the nurse attends patient in the ward after 4 hours of rendering care in the station. Okay? So ibig sabihin ba, Sir Ilde, na in quality improvement, we will not just study the time series na 80%, 50%, 60%. No, you will not just study that one. You need to put informal data collection, like what's the true experience. Okay? Yun yung kailangan natin. Okay, next. It is important to compare baseline data and the data gathered during the PDSA to measure the impact of solutions. So mamaya, makikita nyo, in a PDSA cycle, sir, paano nyo masasabi na may change, may impact na nangyayari? Always compare the baseline data and the data gathered. Okay? Huwag agad-agad sabihin, oy, nag-increase na kami. Oy, dumami na kami. Okay? Compare the data gathered, but make sure you are very conscious with your sample size. Kasi baka naman dumami yung next phase nyo kasi mas maliit yung sample size na ni-review nyo. Okay? Masasabi lang natin that your data is improving if you started small, you progress. Pag sinabi kong progress, hindi pwedeng 5, naging 4, tapos from 50% sasabihin nyo 80% increase. Walang ganon. Okay? That's why QI specialists and QI consultants are very, very conscious in terms of data validation. We always look at the reliability, the data quality. Okay? That's why may portion din kami ng M&E. Remember, there are 6 principles on data quality. Okay? Consistency, reliability, validity, ang dami pa ng IDT, at last is the confidence. Diba? So, kailangan namin tingnan yun. It's not necessarily na if you're a QI specialist or QI consultant or you are a QI team doing some QI work, okay na yan. Tumaas na tayo. Pero pag validate, teka muna, tumaas kayo, pero yung numerator nyo, yung denominator nyo, nag-iba. Yung number, mas bumaba kayo, kaya tumaas yung report nyo. Kaya remember, in the do part pa lang, sa data collection, we don't want you to give us just a draft, no? Ayaw namin nang bigyan mo kami ng draft. Dapat sa baba, meron niyang numbers. Ilan yung census mo, ilan yung nasukat mo. Because it changes over time. It changes over time. And you should put annotation every time. Okay? Next, study the results. In studying the results, the QI team, no, hindi sinabi dito, mag-isa ka bilang QI leader. The QI team, kayo mismo magmi-meeting, magdi-discuss kayo. Did we meet the criteria for success? Did the solution have the desired results? What did people think of the change? Okay? Ay, may pagbabago pero napagod naman lahat. Ayaw na nila lahat, sir. Napagod sila. Ayaw na nila ipagpatuloy ulit. Okay? Which aspect of the test went well? Ano kaya dito yung naging maganda? And which aspect were difficult? Did the solution create problems for others or other process that we need not anticipate? What kind of resistance did we encounter? Okay? Sir, bakit kailangan yan? Bakit kailangan yung resistance did we encounter sa PDSA? Before we will end the 14 weeks, meron kasing organizational assessment. Diba? Alam ko sumagot na kayo doon, organization assessment. But remember, after 14 weeks, meron po mangungulit sa inyo, and that's me. at yung ating QI team. Ako yung mangungulit sa inyo personally to check anong nangyayari sa QI project niyo. Okay? So ibig sabihin pala, sir, after 14 weeks namin dito, hindi kami pwedeng matulog lang, tapos na. No. Kasi yung sinubmit yung QI na nireview ng mga mentors at coach, ifa-follow up namin yan after 1 month. Kakatukin namin kayo. Kumusta? Anong naging problema? Anong nangyari sa QI project nyo? Okay? Sige. Then pag may problema, i-mentor at coach namin kayo. I-improve natin. Sige, tulungan namin kayo. Paano kayo matutulungan? Okay? And how you will deliver that, Sir Ilde? 1 oras lang ng araw ninyo ang hihingi namin. Hindi kami mamungulit ng mahigit ng 1 oras. Bibigyan nyo lang kami ng 1 oras para lang ma-check. Okay? Now, let's go back sa case study. Sabi natin, planado, meron silang 3 plants. Meron pa sila kung kailan nila susukatin. Diba? Pero nung ginawa na nila, on the second day, si nurse pala, hindi pala siya nag-iisa lang. Hindi siya naka-assign doon. Meron pa siyang trabaho sa ward. Kaya bumaba. So sa study mo, anong i-reflect mo? The team reviewed their data for 2-day test. The first day, they had decent results of 68% of patients assessed of nutritional status. The second day, their results were worse because the nurse had ward duties in the afternoon, so no one was responsible for assessing nutritional status. Some patient did not follow instruction to see the nurse. Ako, meron talagang ganito, no? First day pa lang, no? Sa quality improvement, very energetic yan. Gawa, refer. Ay, punta doon. Tapos sa protocol ng QI natin, minsan si nurse pa nagtatawag na, ay, ikaw, after registration, hindi ka pa dito. Punta ka dito. Diba? Ganon yung nangyayari. May nagpupulis, kaya tumaas yung data. Ngayon, nung second day, walang nagpulis. Kasi hapon, pinatawag si nurse, ng kanyang chief nurse, ay, pumunta ka nga dito sa ward, kulang ng tao, walang nag-duty. Tagot na. Wala nang nag-check nung hapon kasi wala na si nurse sa station niya. Tapos, ito pa ang nangyari. Hindi naman sinusunod ng mga tao yung sinasabi ng registration person kasi nga, nakikita ng mga tao, wala namang nurse doon eh. Bakit kami pupunta? Yun ang naging problema nila on the second day. There will also longer lines to see the nurses because one nurse was no longer seeing patient. The part of the idea that worked well was having one person assigned to taking nutritional status for each patient. The part that did not work as well as having the nurse be the person responsible for doing so. Diba? Ay, ang haba na ng linya. Ang taga-registration, usually yung person sa registration, napakabilis. Pangalan, apelyido. Okay, ito ba yung hospital number? Ito ba yung patient number mo? Anong problema natin ngayon? Sige, punta ka na sa nurse. Next, number. Ganun, mabilis ang registration. Ang ending, dahil si nurse magsusukat, pangalan, address po, pakisuyo po ng braso, susukatin po, mas mahaba yung kanyang mga spiel. Diba? Mahaba yung kanyang chinichika. Ang nangyayari, humahaba yung linya ng pasyente sa kanya. And one thing is, mag-isa lang kasi siya. Nung nawala siya, wala nang nagtitingin ng pasyente. Wala nang nagsusukat. So sabi nila, what work with our idea is that one person should be assigned only in taking the nutritional stuff for each patient. However, ang hindi nag-work is that we give the responsibility to the nurse lang mag-isa. Wala nang iba. Pag nawala siya, wala nang gagawa. No? Same with that. Sa ating mga nasa mga facilities, no? Pag wala ka, makaka-receive ka ng text, yung report mo, isubmit mo naman. Ma'am, nakalip ako. Ay, walang ibang gagawa. Kailangan mo isubmit. Di ba? So, pwede mong gawa ng QI yun. Paano kaya? Paano kung gagawa ng QI yun, sir? Well, you do. You improve your processes. Na dapat, na, kahit wala ka sa office, everyone na naiwan sa office, kaya nila. Ha? Kaya nilang i-deliver yung task mo. Okay. Wow, sir, ganun lang pala yung PDSA. Ang simple lang, sir, no? Dapat may plano kami. Dapat pag ginawa namin, dapat hindi lang time series, dapat may informal data din kami. After pala nun, sir, isusulat namin siya sa study. Ano yung nangyari, makikita sa draft, ano po yung mga challenges, ano yung nakita namin na what went well, ano yung nakita namin na what went wrong. Okay? Now you go for the acts on the result. Based on what was learned from the study results, the team can decide what action to take. Not every solution that is tested is then adopted. Okay? Remember, hindi lahat ng solusyon ay ina-adapt. Yung iba, ini-improve. Yung iba, nire-reassess. Yung iba, minomodify. Pag hindi talaga kaya, wag na, kalimutan mo na lang, abandon. Okay? So, ibig mo bang sabihin, sir, base doon sa aming mga findings sa study na part, doon kami iisip if, modify ba namin? I-re-assess namin? Magdadagdag ba kami? Or hindi na? Waste of time? Tapusin na namin? Okay? So in acts on the result, you need to look at the following. Okay? As a team, you should ask yourself the following. Did the tested change show promise? Yung hypothesis ko kasi dapat pag meron na yung plano na yan, dapat na-assist na ng 60 above eh. Biglang nag-52. Nga kasi isa lang yung nurse mo. Okay? If not, they may need to abandon the idea and test another change. So sabi doon sa change show promise, what if Sir Ilde may kaunting improvement? Then you need to modify. Do not abandon. Okay? Uulitin ko. Sir, nag-test kami. May kaunting change. 1, 2, 3. Give up na po ba kami in quality improvement? No. Sir, pag ganun po ba, kailangan ba namin i-modify? You go to the next question and the answer is yes. If so, they need to adapt it and run PDSA again on a small scale. Sir, may kaunting improvement eh. Pero sir, nakita namin, may dadagdag lang kami sa plano namin, pero same lang din. Parehong number ng pasyente. It's okay. Why? Ano yung minodify nyo? Yung plan nyo, yung intervention nyo. Pero tinest nyo ba ulit sa malaki? No. You test it with the same scale, small scale lang. Okay? And you will use adapt. Letter A. ADAPT. Okay? A. Did the work very well? Did it work very well? Kung sabihin, sir, grabe, over 3 months, sir, nag-improve eh. Nag-improve talaga kami, sir. If so, they will need to test it at the larger scale before they can be ready to adopt it. Anong gagawin namin, sir? Sir, dati kasi, yung tinarget namin, 50% ng nag-miss ng mga visit nila ngayon. Yun yung tatawagan namin. Sir, over 2 weeks, bumabalik sila yung 50% na tinawagan namin. Next time, sir, gawin namin 70% na nag-miss ng kanilang appointment. Yun yung tatawagan namin. Sir, very promising din. Bakit? Yung 75% na yun, sir, nang nag-miss ng visit nila, 100% sa kanila, sir. Bumalik nung sa schedule. Nag-refill sila on time. Ay, very good pala. O anong gagawin mo? Sir, pwede ko ba sang gawin na 100%? Pwede naman. Ang tanong, may tao ka ba? Sir, magdadagdag ako ng tao. Ha? Para may tumawag. So nagdagdag ng tao, nag-reach ng 100%. Ni-revise ba nila yung original plan nila? Yes, kasi dati isang tao lang, ngayon gagawin lang 2 tao. Pero they will go also for a larger scale kasi. Diba? Sige, 100%. Sir, medyo 80% pa. Pwede ba kayo magdagdag ulit ng tao? Sige, gawin mo. Anong ratio ng tao mo? Siguro sir, 1:5. 1:5 na clients na nag-miss, isang tao yung tatawag. Sige, gawin mo yan. Sir, mag 100% kami. Sir, i-adapt na ba namin na letter O? Ilalagay na ba namin to sa aming guidelines, sa aming standards? Not yet. Not yet. Not yet. Okay? On the first time that you have achieved into 100%, not yet. You need to make another run of a test. Dagdagan mo. Sir, sagad na yung 100% kasi nga tinarget namin 100% ng client nag-miss. Just give another round. Another round. If it proves that 100%, given na 3 yung iyong tao, tiglilima sila na tinatawagan, after 5 days or 3 weeks, bumabalik 100% for 2 runs. 2 runs. Adapt that one into process policy. Huwag mo nang paalisin yung 2. I-renew mo na. Bigyan mo na ng pasahod ng matindi-tindi para hindi ka naiwanan. Ha? Para lahat ng pasyente wala nang nag-miss. Okay? So, yun yung kwento ng acts on results. Let's go back with the case study. Anong nangyari? So, based on the results, the team felt that having someone responsible for MIWAC assessment at registration was a promising change. What if kaya hindi na kami mag-direct doon sa nurse? What if registration pa lang, total nag-i-interview kami, may mag-check na kaya? But it needed to be modified to work better. The team decided that they would teach several volunteer expert patients to help with the MIWAC assessment and have them located at the registration desk for their next test of change. Sige, dahil si nurse pala maraming ginagawa. What if yung tagakuha namin ng measurement, ilagay namin sa registration na, tapos mag-train kami ng volunteer. Then i-check namin kung tataas. Okay? So, ibig sabihin, in quality improvement, we don't want to see, sir, ayaw na, stop na kami. No. Not agad. Unless you lack logistics, you lack resources, you have external factors. Okay? Unless. Okay? Now, application of PDSA in HIV care. Oh my God, sumobra ng oras. Let's have first a 5 minutes break. Then after that one, we will start the application of PDSA in HIV care. I will show to you 2 examples of break. Parang dinadala ka sa isla. No? Let's have a summer feel na daw. Okay. Okay, balikan lang natin, no? A short review, no? PDSA. When I say PDSA, you should have plan, do, study, and act. Pag sinabi ko bang plan, ang gusto ba niyang makita, ang gusto niya ba niyang alamin ay kung paano mo i-implement yung intervention na yon. Kung yes, can you type sa chat box 1? Kung no, type sa chat box na 2. Pag pinag-usapan yung plan, ang kailangan mo ba dito ay detalye kung ano yung gusto mong gawin, who will perform, how it will be performed, and when. 1, 1, 1, 1, 1. Okay, very good. Okay. Ngayon, pagdating sa do, ang sabi natin, sa do daw, i-document daw natin. At ang pagdo-document daw ay formal kagaya ng data sa time series lang. 1, if yes. 2, if no. Sabi sa do, gagawin lang daw natin to. Pero ang i-document lang daw natin ay formal data. Ito yung mga data sa time series. Formal data lang ba? 1 if yes, 2 if no. Halo-halo, no? Sabi ng iba, hindi sir, 2, 2, 2, 2. May nagwa 1, 2, 2, 2. Okay? The answer is no. Remember, in quality improvement, we should also document the informal data. Kaya may tinatawag po sa data run charts na pag-uusapan natin after the workshops, no? Yung tinatawag na annotation. Okay? Annotation. Bakit importante annotation? Because we will go now to your study. Sabi ba sa study, the results, ang i-describe mo lang ba ay yung what went well? Hindi mo isasama yung what went wrong? Sige nga. Sagot nyo ay yes if 1, 2 if no. Very good, ano? Kailangan mong i-document also yung what went wrong. Okay, very good. Ngayon, sa act tayo, merong 3. Abandon, adopt na letter A, adopt na letter O. Sabi doon, if ang ating plano ay hindi siya nakapag-contribute sa change, walang nangyari, kasi of external factor, kulang ng logistics, resources. 1, if you will abandon. 2, if you will adopt with letter A. 3, if you will adopt letter O. Anong gagawin nyo? 1. Very good. Now, what if yung plan ninyo naging effective siya in a small scale? Tapos, chinek nyo rin, improvement din siya. Meron din, nag-medium scale ka, nag-large scale ka, tapos nag-run ka ng 2. Improve pa rin siya. Continuous yung improvement. Anong ilalagay mo sa act? Is it 1, abandon, 2, adopt with letter A, 3, adopt na may O? Sige. Anong gagawin nyo? 3, 2, 2, 2. Okay. Ngayon, remember, ang word is na-sustain yung improvement. Pag na-sustain yung improvement, that's O, adopt. No? When you say adopt, now with letter A, you will modify some part of that intervention. Okay? Very good, very good, very good. Thank you for your responses. Okay, para mas maging maklaruhan kayo, I will give you 2 examples na it's a true-to-life experience ng kino-coach namin. It's not part in the Philippines, but it is internationally. Hindi kasi ko pwedeng i-feature yung sa Philippines na mga kino-coach ko because I have still a non-disclosure agreement. Okay, unless lang i-cover ko yung names, no? But I haven't done that yet. Let's use this from the international facilities na kino-coach namin. Okay, because we have done with the NDA with them, and I have the full, acknowledgement and disclosure about this. Okay. Tatandaan nyo lang, minsan kasi sasabihin natin, sir, yung PDSA ba, yung quality improvement, pag nakakita na kami ng Gantt chart with annotation, tama na yon, tapos na yon. Ano ba, sir, yung format dapat? Yun yung usual na tanong sa amin. Ano po ba, sir, yung format dapat ng PDSA pag dino-document namin siya? Kasi remember, sabi doon, you document. Ha? First is, kaya pala, sir, tinanong mo kami, what's the problem? What's the gap? O, kailangan mo dun ilagay sa taas yung gap. Yung aim din, nasa baba ng kaliwa ko, no? Kung nakaharap ako sa iyo, nakaharap ako sa screen, ay nasa kaliwa side, aim. O, kaya pala, inuna talaga sa amin ni Sir Ilde, anong problema? Anong gusto mong gawin sa problema? Paanong intervention yung gagawin mo? Then, pupunta ka na agad sa plan. Ay, sige nga, sir. Ikwento ko dito yung plano ko. Okay, paano mo ikukwento? What change are you retesting? Identify mo step by step. Who are we testing to that change? When are we testing? Where are we testing? What data do we need to collect? Who will collect the data? When will the data will be collected? And where will the data be collected? Huh? Sa plan, sir, kaya pala binalikan mo yung performance measure plant development in a simplest form para malaman din namin na, kailangan pala ganito. Kaya pala, sir, halos nakatatlong session tayo ng measurement planning. Kaya, kasi sir, sa plano pa lang, dapat meron ka ng panukat. Correct. Hindi po sa do na part ginagawa ang measurement. Nasa pagpaplano pa lang, gawa na dapat yung mga measurement. Okay? Next, do. What was done to implement the change? Was the change implemented as planned? What were the barriers of implementation? Okay? What change acceptable to staff and patients? Then study, you analyze all the data, you summarize lessons learned. Did the change result to measurable improvement? And act, adapt, or abandon the change. What needs to be modified before the next PDSA cycle? What should the next PDSA cycle test? Then you will provide measurement. How will we know that this change will result in an improvement? Kaya pala sir, yung measurement na part na yan, hindi siya sa banda sa study sa act. No. Bakit Sir Ilde ganyan yung hitsura ng pagdo-document ng PDSA? Remember, sa planning pa lang may measurement ka na. Sa do pa lang, ginagawa mo pa lang, magsusukat ka na. May measurement. So ibig pala sir, in plan and do, measurement ang tinitignan namin. Paano namin susukatin yung ginawa namin at pag nagawa na namin, paano namin siya susukatin? Then Sir Ilde, bakit yung aim nasa act and study? Remember, ang study sabi niya, you analyze the data, but you must analyze the data kung ano yung effect nito doon sa gusto mong mangyayari. And you should act. You make a decision. You make a concrete decision-making or recommendation if yung change idea mo, yung measurement of improvement mo, ay nakapag-produce ng change, naka-apekto doon sa aim na gusto mong mangyari. Kaya ka makapag-decide, adapt, or abandon. Nakuha? So kaya ganyan yung hitsura if you will document a PDSA. Okay. Sir, hindi siya bilog, oblong siya. It's okay. The figures will not matter anyway. It is the content that matters. Okay? So, ibig sabihin, sir, saan namin ilalagay yung mga run charts, annotation, mamaya yun. Parang attachment yun. Okay? Example, okay, let's focus on the loss to follow up. Kasi marami sa inyo na problema. Sir, ang dami namin loss to follow up. Anong gagawin namin? Okay, nung nag-root cause analysis tayo, sabi natin, kaya pala nag-loss to follow up, incorrect yung contact information ng pasyente sa kanyang care booklet. Nagki-care booklet ba kayo? I saw one patient who is accessing claims in SSS and PhilHealth that meron siyang patient care booklet. Very nice yun. Meron siyang patient care booklet copy niya. Tapos, yung lahat ng information nun, updated yun. Tapos, tuwing nagpapakonsult siya, pinapakita niya yun sa staff. Okay. Ngayon, nangyari kasi sa clinic it's international. I will not disclose where it is, no? Nagkaroon ng difficulty physically and telephonically tracing loss to follow-up clients. Why? Unang-una, mali yung kanyang address or nung unang visit niya, nagre-rent lang siya. Tapos ngayon, sa pangalawang visit na schedule niya, nag-change na pala siya. Lumipat na siya ng bahay kasi nasistigmatize siya, discriminate siya doon sa area. Lumipat na pala siya. Okay? Tapos, yung cellphone number niya, iniba niya. Hindi na matawagan doon dati. Lost to follow up. No? Hindi na matawagan, hindi makontak. So, anong ginawa? Sabi ng team na kinuay namin, sir, i-update namin yung contact information. Ilan ba yan? 70, sir. 70 care booklets. O sinong gagawa niyan? Sa kanila kasi is very active yung community health worker. Sir, kasi LGU-based to eh. Sir, wala kaming community-based. Okay lang ba yung barangay health worker namin or yung community health worker namin, yung mag-update na client information? Sige, saan mo gagawin yan? Sir, sa clinic registration area, bali hindi ko po pupunta siya sa bahay kasi hindi naman po nare-reach doon sa kanyang inupahan. Pagbalik po niya, doon ko siya i-update. Tapos, sir, i-follow up ko na lang din. No? Then, kailan mo gagawin yan? For the whole week, sir. From March 1 to 7 for 2017, tatapusin namin yung 70 na yan. Pero isa lang yung community health worker namin, sir, para less yung stigmatization, no? Para siya lang mismo yung may data confidentiality at privacy. Okay. Sabi niya, paano mo susukatin yan? Siguro, sir, dahil ang gusto namin ma-update yung booklet, one is the number ng booklet na na-update, ng contact number. Pangalawa is proportion ng active caseload namin na nag-close to follow-up. So, ganun yung gagawin namin. Okay, sige. Ganun pala yung panukat nyo, dalawa. Okay. So, titingnan nyo yung measurement. Updating the booklet of contact information is a process measure or a sub-process measure. One, kung sinasabing yung process measure. Two, if sub-process measure. Yung number of patient care booklets with updated contact number information, is it a process measure or a sub-process measure? Sige. One, process measure. Two, sub-process measure yan, sir. Sige nga. Can you send sa chat box? Halo-halo na, no? Okay. Sige. Ano ba ang sagot dyan, sir? Remember, sabi natin, a collective process will give us an outcome. And in HIV care, the outcome that we want to see is viral load suppression. And to attain that viral suppression, you need to diagnose, you treat, you retain, you link to care, you treat, then you retain. Ang loss to follow-up ba, saan siya parte? Loss to follow-up is a process to retain a patient. Ba? Problema yan sa retention of care. So, yung proportion of caseload that is lost to follow-up is a process measure. The number of patient care, para sir mabawasan yung lost to follow-up sa caseload ko, mag-update ako ng booklet. Updating the booklet is a sub-process. Okay? Huwag kayong magulo doon. Okay? Dalawa ang sinusukat dito. So, ibig sabihin, ang sagot dito ay 2. Yung number of patient care booklets with updated contact information is a sub-process. Okay. Meron na. Sir, papangalanan namin yung aming project na Project Hope. May pag-asa sa mga nawawala. Okay? So, very interesting to because it's a very jolly group that they said, sir, there's hope for everyone. Doon sa mga naglo-lost to follow up, may pag-asa. Oh, sige. Sige. Yung isang tao dyan, yung community health worker, sabihin natin, i-update niya. Doon naman, nag-update siya. But during the do part, ang barriers ng implementation includes, hindi naman siya yung case manager namin. Sino siya? hindi nakabuild ng rapport ang community health worker sa some clients. Kaya yung iba, hesitant magbigay ng information, mag-update. Hindi. Ayoko, ma'am. Hindi ko siya case manager. Ha? May ganon. Poor documentation of updated information. Kasi sir, hindi talaga nila ako mabigyan eh. Purong report na develop ko. Kaya ngayon parang poor pa rin yung documentation, updated information ko. Then, existing workload of community health workers. Sir, hindi naman 8 hours na nandiyan lang ako sa center eh. Volunteer nga lang po ako, kaya umuwi po ako. Okay? So what happened? Sabi doon, between March 17 to 2017, only 3%, 3 or 4% of the expected 70 patients care booklets were updated. Rate of loss to follow-up pending in April. Bakit? Bakit kaya sir wala pang improvement on sa loss to follow-up? Bakit sir hindi namin ma-report sa study na may active na kami na loss to follow-up? May bumalik na sa amin na loss to follow-up? Hello? Immediately ba within March 7 to 28, pag na-update mo yung information, babalik agad yan? Pag tinawagan mo ba, kailangan namin ng updated information mo, pumunta ka dito sa clinic, babalik ba agad yan? Hindi. Madaming reasons yan. Madaming reasons. Busy, sir, malayo, sir, wala kami dito, wala kami ganyan. Okay? So immediately, so pwede pala yun, sir, na yung study namin, ang i-measure lang namin, i-reflect namin, yung sub-process lang, ano yung nagawa namin. Hindi muna namin ano yung process namin na loss to follow-up. Oo naman, kasi give it a number of days para bumalik yung loss to follow-up. So what you will do, may slight na improvement. Sabi ko nga sa inyo, kahit 1% lang yan, 1% or 2% na increase, labanan niyo yan. I-adapt nyo ng letter A, adapted. Then ano ang gagawin mo pag letter A? Next PDSA will enlist 2 additional community health workers to assist updating client information and outcomes will be remeasured. Since isa lang siya, ang challenge namin dahil mag-isa lang siya, next time dadagdagan namin. Ngayon, hindi pa namin masusukat yung outcome, which is gusto namin makita yung loss to follow-up. Susukatin namin ulit. Tingnan namin sa susunod na phase. Anong ginawa ng clinic na to? So, 1 community health worker to update the contact details, 4% ang kanilang data. Okay. Sabi di ba adapted? Same pa rin. Pero ngayon, nag-hire sila ng 2. Naging 3 na yung community worker and in 1 week, sabi nila same approach. Project Hope pa rin and TCA were assigned to update contact information. Anong naging barriers ngayon? Included pa rin low rapport between the community health worker and some clients kasi hindi ko nga siya case manager. Very, yung aking status. Ayoko i-disclose. May stigma siya. For documentation of updated information, some clients providing false information. Dito nadagdag na, may false information pala. Ngayon, tinignan nila. In-update nila yon, naayos nila, no? Oops, between 8 to 14 for 1 week, naka 40 or 56, 57% of the expected patient care booklets were updated. Rates of log to follow up, hindi pa rin makita kasi within 1 week na hindi mo agad-agad makikita na bumalik yan. Okay. So ngayon, the process measure nag-improve. Tapos, ang target mo ay, remember, 70, di ba? Dapat mag 100% ka. Sabi niya, adapted pa rin. Pero ang gagawin natin, what if mag-enlist tayo, entire clinic team, yung mag-assess ng updating ng contact information. Buong team na kaya, kasi tingnan mo, 3 lang sila, naging 40%. What if buong team na tayo? Gumawa tayo ng team to update. Okay? From 4% na isang community health worker, nagdaglag silang 2, nag-57%. Nag-stop na ba sila? No. Next, ginawa nila. Update, entire clinic team. Lahat tayo, mag-update tayo for 1 week. Entire clinic team was assigned to update the contact information. Anong nangyari? March 15 to 21, 90 of expected 70 care booklets were updated. Na-found out pa nila nung dumami sila, hindi lang pala 70 yung patient care booklets namin na hindi updated. Umampas-pasan ng 70. So na-shock kami nung ganun yung nakita namin. But the rate of loss of follow-up still pending. Hindi pa namin makita ng buong March eh. Hinintay pa namin yung April bago namin makita yung loss of follow-up na nag-decrease. Okay? Nakita namin, uy, bakit mas dumami? Yung kulang, yung hindi pala na-update na booklets. Because you cannot determine na ito lang yung target na ang assumption natin na booklets na hindi updated because some data in sabihin na lang natin sa mga reporting system natin, may mga data glitches talaga. Okay? Pero itong lahat ng team na to, nag-deploy, ay, updating na ito. So what they did, in-adapt na nila. Oh, sir, wala pang outcome measure. Hindi pa nakita ko nag-approve yung loss to follow-up. It's okay. Why? Remember, their measurement here is looking for the sub-process of updating. Kasi yun yung problem nila. Remember? The problem nila is incorrect contact information. So, anong ginawa nila? They changed their standard operating procedure. They draft on how to update the patient contact information. So ngayon, dati, wala kasi silang, sanay kayo dito sa RHU. Register the client. After registration, wala tracking ng loss to follow. Same lang yan when we did a QI for immunization. Same lang din yan nangyari nung nag-ano kami ng family planning ng mga QI. Walang SOP in updating patient contact information tuwing kailan ba dapat kami nag-update. And that's the start. Sabi nila, ay, effective pala to. Dapat entire team. No? Ang ginawa nila sa SOP nila, dinagyan nila ng calendar or sa scheduling nila, may naka-deck. No? Na, okay, Team E, Team B, Team C, kayo yung mag-a-update for this week, this week, this week. Nakita nila that every day, every week, as they update their patient contact information, they had experienced change. And do that, target achieved, and they drafted their SOPs and change adapted into routine practice. Okay? So, ganun pala yun, sir. Hindi agad-agad, dahil na-achieve yung 120, pag dinaf na yung SOP, titigil na kami sa QI namin. No. You will do a series of tests. You will continue that one to check for sustainability. And remember, standards of practice can be applicable as to this moment, but 2 years from now, it will not be feasible. Okay? Or 6 months from now, it will not be feasible. Okay? Okay. So continuous monitoring to ensure sustained improvement. So hindi namin sinabi, huminto ka na dyan. But ang sabi namin, you continue monitoring to ensure sustained improvement. Okay. Any questions so far? Naintindihan nyo paano ginagawa ang PDSA? Can I get some heart reaction if it's clear? Okay. 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 Okay, so kung may mga questions ha. Okay, now, let's link PDSA to large-scale improvement. Okay, very small follow-up test new condition in the large scale based on Langley's principles. Dito. As I have mentioned to you here, this is the second example. This second example looks at, in the patient in Ichiban Clinic report, unfriendly services. Meron ba kayo ditong for example, sa customer satisfaction nyo, nag-report, naku sir, ma'am, 25% yung mga pasyente nag-report, unsatisfied daw sila. Bakit? Masungit daw yung ating mga case manager. Hala, anong gagawin natin? Okay? So dito, ang ginawa, connect patients to peer navigators. One peer navigator will be connected to each patient and clinic registration area, and it will happen in January 2, 2018. Ang measurement is acceptability of peer navigator program. Ang another measurement is proportion of patients who found peer navigator to be helpful. Sir, bakit yung mga measurement parang more on sub-process siya? More on process siya. Remember, what's the concept of quality improvement? We improve the process. So dapat yung measurement mo, kung ano yung in-improve mo sa process, yun yung magre-reflect dyan. And you have your aim to justify if nami-meet mo yung gusto mo mangyari. Okay? Here, din nangyari, unfriendly yung staff, services. Tapos nagkaroon ng National Survey for Stigma and Discrimination. At yung site mo ay na-identify as one of the survey site na isa sampling. Naku, nag-report ang National Office. The clinic H1 has a high stigma and discrimination index ranging from 7 to 9 scores out of 10. Patay, ang taas. Ang gagawin natin. Sige sir, baka kailangan siguro maggawa kami ng peer navigator na siya lang talaga yung magkukonek sa pasyente. Kasi baka sasabihin nila, masyado kami unfriendly, hindi kami kasi sobrang busy namin, di ba? So dapat meron kaming taga-isa na nagko-connect sa kanila, kumakausap sa kanila. Okay, sige gawin natin yan. In Do, one peer navigator was assigned to each patient who presented onto care on January 2, 2021. So for example, 10 yung dumating na pasyente, 10 peer navigator, one-on-one. Para, uy, kumusta sir? Welcome sa clinic namin. Anong gagawin namin? However, nung ini-implement na to, ang naging barrier ay lack of understanding of some peer navigators about care needs of patient. Nung tinanong lang nila, sir, kumusta ka? Anong gagawin natin? Magre-refill. Ay, sir, dito po tayo pupunta. Ganyan po, ganyan. Nag-refill. Pero hindi niya tinanong, sir, meron ka bang ibang nararamdaman? Sir, meron ka bang na-experience na kakaiba nung after mong mag-take ng ilang bottles or ilang pills? Hindi ganun. So, kulang yung understanding ng peer navigators paano makipag-connect sa pasyente about the care. Kasi case manager nga lang yung na-train natin. However, dito, 8 ang dumating. 7 out of 8 sabi, they felt that they are more welcome. No? They are more welcome. Pagdating namin, parang VIP kami. May isang peer navigator. Social. Okay? Sabi ng clinic Ichiban na ito, okay, sige, i-adapt natin yan. Pero, re-revise natin yan. Ang gagawin natin, i-train natin yung peer navigator. Huwag lang sila masyadong Huwag lang silang tanong ng magre-refill ka ba? Anong kailangan mo? Magpapalaboratory ka? Isang ganun kasi, di ba, nangyayari? Okay? Inform natin sila kung paano magkaroon ng care assessment. Patient-centered care. Okay? Sige, ginawa nila yon. So sabi natin sa PDSA, ang itsura nila, then, we improve. Sabi natin, okay, sige, one peer navigator pa rin, pero nag-train na ito, tingnan natin. So there's a cadre of peer navigators. During that day, there were 12 patients. And each one has peer navigator. These peer navigators were trained. At nandun sila. Can you remember the gap? January 2, February 10. So we developed the module on how to communicate to these clients for 2 weeks. The development of module on how to approach these clients, 2 weeks. We trained them 1 week. Then after the training, 3 days after, salang sila. Okay. 15, 2018 yung date na document natin. After the training, they were very happy. There's a cadre of peer navigators. Okay? Sino-sino to? Pwede siyang case manager, pwede siyang clinic assistant, pwede siya si clinic manager. Kasi kung ilan yung number ng clients, dapat maging una ang peer navigator yung mga CBS motivator. community health workers. Sunod, pag kulang na talaga, pumapasok na si case manager. Tapos pag kulang pa talaga, pumapasok na si assistant clinic manager. Pag kulang pa, pumapasok na si clinic manager. Hanggang kahit yung medical director nila, nag-cater na ng patient kung kulang na talaga. Okay? But here in their clinic, they have more than 14 CBS motivators. No? Sabi dito, 12 out of 12. Sabi doon sa survey kasi, di ba? Pagkatapos nila doon, magsa-survey sila. Ma'am, here's our survey. Here's a QR code for our survey. Can you please rate the service that we have provided? Di ba? Ganon. In-integrate nila sa kanilang survey. Nandun yung pinaka-last, how do you find my care? Okay? Ganon yung tanong. How do you find the care that the peer navigator provided? Okay? Parang si Baymax. Are you satisfied with my care? Ganon yung phrasing ng question. Then 100% sabi na, ay sir, swerte namin ang VIP. So parang walang discrimination dito sa clinic niyo. Ang ganda. But however, despite na 100%, we did not recommend for an immediate adoption or inclusion to policy or revision of SOP. Letter A pa lang siya. Why? Why, sir? Ba't hindi nyo agad? Remember, kakatapos lang mag-training ng mga staff na to, so fresh pa talaga. So talagang medyo advocate pa to. Tingnan natin later on. Ano kayang mangyari sa kanila? Okay? Nag-increase, no? Yung kanilang clients. Okay. Next, we connect the patient again. Clinic registration, March 2018. There's a cardiolet train. Kasi QI, sabi namin, natapos na namin sa February. Sige, i-test namin siya ng March. Tingnan namin. Randomly. Kung mariretain ba yung kanilang training. Okay? Out of that process, 237 patients for the whole March. 237 patients. Pero 222 lang nagsabi na they felt more welcome. 94%. Sir, bumaba yan. Bumaba siya. Kasi 100% last time. It actually increased. Why? Bakit nyo i-adapt na, sir? Remember, the second is only more than 10 clients. 12 lang. Diba? 12. Then, nung March, halos lahat na ng kliyente, lahat ng pasyente, when you welcome, minessure namin yon 237, 94%. I-compare mo sa 12 na patient. Diba? Ang 12 mo ay 200% mo yan, that's equals to 240. Almost 200% ang client na minessure mo dito. Kaya nga sabi ko kanina sa PDSA lecture natin, be careful in the measurements, especially looking at the denominators at numerators. Data quality check. So sir, dahil malaki na to, almost 200% ang bulk ng pasyente, 94%, is that okay? For us, quality improvement specialists, that's okay. Okay? So, 100% out of that 94. Magsa-stop na ba kayo, sir? Given na na-achieve nyo yun? No. Again, you still continue and sustain for improvement. Hindi ka pwedeng matapos ng ganun-ganun lang. You check, you check, you check. Okay? Ay, last na pala yun. So any questions, clarification? Mas naintindihan niyo ba yung essence ng PDSA? Can I get some reaction if mas naging klaro sa inyo to? Okay. Yes, mas clear. Okay, any questions, clarification? So next week, ang pag-uusapan natin is mentoring and coaching kasi baka makalimutan niyo yung theory. Babalikan natin yung ginawa niyo dati. Pupunta tayo sa driver's diagram at measurement. Tapos after nun, on the week 11, magpi-PDSA tayo. Pag nandun na tayo sa week 12, doon ko ikikwento paano yung proper na data sa do Okay? Sa do, remember you will have formal and informal data. Kailan ka mag-annotate at kailan ka magdodraw lang, sir, ng time series. Okay? So, you have any questions, clarification so far?
Baka po may question kayo. Or raise hand na lang po.
Okay. Ako, parang sobrang tahimik, kinakabahan ako. So may workshop po kayo next week. Okay? Workshop tayo. Magbibigay lang ako ng 30 minutes background ng ano yung workshop natin. Then after that one, breakout session. Siyempre, yung hindi natawag last time sa breakout session, kayo yung tatawagin namin ngayon. Okay? Kasi we will give everyone an equal opportunity. Okay? So, yun yung magiging run natin. Okay? So, kung walang tanong, ako po ay nagpapasalamat for always listening to me and very active yung participation niyo. I'm so happy. I hope everything is clear. At kung meron po kayong na baga-baga, ewan ko, if there are doubtful or confusion part, please just email us. Okay? Huwag kayong matakot. Okay, now I will give the floor to Ivan for a wrap-up and administrative discussion. Ivan?
Ayan. And for participants, Sir Ilde po ng Heart React. Thank you so much, Sir Ilde. And yan po, update lang din for assignment. Nakikita po namin, binubuksan po kasi namin for folder. May mga nag-upload na po at nagtawag po kasi kami before. Marami na din po nag-respond at kumbaga best effort, Sir Ilde, na maggawa ng assignment. Pero yun next week po natin.
I guess medyo unstable yung Ivan na
With that, thank you so much, HTB mates. Open our camera natin para po. Ayan po. Hello, sir. Okay.
medyo choppy ka tayo.
Ayan.
Ayan.
Medyo choppy po. Pasensya na po. Paki-open na lang po ng camera. Sige po. Screen 1. Smile po. Okay. Screen 2. Smile. 3, 4, 5, 6. Ayan. Tapos na po. Maraming salamat po sa lahat.
Thank you, everyone. So, I would like just to request our mentors and coaches to please stay for a while. Thank you. Ayun, parang madami pa sila.
Sir mo, okay na po. Sir, naka-mute ka, Sir Ilde.
Ano ba yan? Sorry, kanya po nagsasata. Sorry. Mariel, Che, Bernard, Rad, Ivan. Thank you for always no being part of the mentors and coach. By weekend, I will distribute an instruction how we will facilitate the Thursday para medyo by Tuesday may counting background na tayo para mabilis lang, hindi tayo kakain ng 2 oras. Okay? Just a quick to make you have a good background, how I evaluate your feedbacks and your performance. Remember that our coaching approach here, nakikita nyo, um, sinusundan natin yung 7 skills no, na kailangan ng bilang effective na coach. You need to be a QI catalyst. You need to be a collaboration builder. You need a strategic thinker. You be a capacity builder, facilitator, measurement advocate, and objective assessor. Measurement advocate, I cannot measure it for now since ang schedule natin ito ay schedule natin to next week pa yung ating magiging workshop nito. So about measurements. In objective assessor, mas i-validate ko siya if you are able to facilitate yung PDSA cycle. Okay? So yung F and G, hindi ko siya bibigyan ng feedback as your scores, but A, quality improvement catalyst, collaboration builder, strategic thinker, capacity builder, facilitator, bibigyan ko siya ng rate from 1 to 5. Okay? So pag 5, that would be 95% to 100 yung score nyo. 4 would be from 87 to 94%. 3 would be 80% to 86. 2 will be 70 to 80%. And 1 will be less than 69% and below. Okay? Yun yung grading na ibibigay ko sa inyo. So, you will receive an email about this one, pero bibigyan ko lang kayo ng pasada anong lalamanin ng feedback. Okay? So, ang feedback natin for letter A, nakikita niyo yung letter A, that's part of your skills for quality improvement catalyst. It like provides an improvement framework for advancing HIV context for organization and objectives. Okay, yung letter A, ito ay ibabase ko on how you facilitated the first run, like the rule of 1, looking at ano yung problem ng organization in terms of HIV care and quality management. Okay? Yung letter B, hindi ko na iisa-isahin na. Building trust provides ensuring stakeholders, roles utilization, effective negotiates group processes while balancing individual needs. It refers on how you are able to provide comments, constructive comment, no, mentoring suggestions, offline and online. Okay? Letter C, which is strategic thinker, I will assess this one using how are you able to provide feedback doon sa activity nila in terms of sana ba aim statement. Okay? And aim statement at root cause because you need to be strategic on that part. Letter D is all about your capacity to collaborate with them, to communicate, and letter A, your facilitation skills. Okay? So, ang F at G, it will be rated during the workshop natin next week and on the next week 12. Because on week 13, we will have a lecture on how they will plot that one. And on the 14th, I will have a lecture on how to present their QI in a so-called peer learning network using a project storyboard. Okay? So question sa ating mga mabubuting coach, are you okay with this objective assessment? Okay ba kayo dito? Ay, naku.
Yes po, sir.
Okay ba kayo? Any question from our EPIC team? Meron ba? Or okay kayo? Okay sila Che, Bernard, Mariel, Rad? Okay, sige. After this one, isi-share ko sa inyo yung Excel file na to. Then, isi-share ko din sa inyo yung mga ratings. Oh naman, syempre. No, based sa mga observation, para objective naman tayo. Okay? May makikita din kayong mga screenshot of your mga kinomentan, mentoring something. Na? So, medyo ganun ako pag nag-rate. Okay. So, may skills tayong hinahanap dito. 7 skills to. And I hope may na-learn kayo sa amin din. Okay? So, this is not just the last day natin. Marami pa tayong pagsasamahan.